I'm a big fan of SMILE, but it does not mean that all the other procedures are not good. So yeah, I try to explain why, and I want to give you a short overview of the refractive lentic extraction. So basically there are 4 platforms available which are feasible for lenticle extraction. It's the size Dirisamer 500, the newest one is the 800, the Atos from Schwind, and the Z8 from Dirisamer. There's another one coming up, but these are the 4 which are commercially available. So the evolution of corneal refractive surgery, I showed the slide yesterday already. And as I mentioned, since 12 years, SMILE is available, it's on the market. The procedure itself, here's a short video, it's I think very well known. It is certainly more surgical challenging or demanding than the other refractive procedures because we have to do surgery, so we have to remove a lenticule, which sometimes could be a little bit tricky, which is sometimes very sticky, so we have to remove tissue bridges and stuff like that. So in this case it's of course a smooth one, but I'm not only showing smooth videos, you will see later. So we will see some complications as well. So first you try to remove the tissue bridges from the cap and then from the lenticule cut. So first go on top and then underneath. It's very, very important. And then try to smoothly loosen this tissue bridges. You can use this spatula. It's semi-sharp, so to speak, so it's not really blunt and not sharp. Very helpful. And then it's easy to remove this lenticule, just grasp it with a forceps. So the indications are pretty similar to these ones from myopic SMILE. So again, these are the German rules, so to speak. It's from myopia from -1 to -8. -1 is the limit, so you can go to -0.75, but the machine does not allow you to go even less. Astigmatism up to 5 diopters, so the borderline you can do -10 myopia and astigmatism up to 6. And still hyperopia is not approved, but it's a question of time. I think in this year we will have the hyperopia treatment with SMILE as well. What are the side effects after SMILE? Similar to those of LASIK patients, like dry eye. And we have, which is called corneal intransparency. It's not really haze. Many colleagues say it's haze, but it's like it's different. So it's like spotted over the cornea. And if you observe this corneal intransparency, you should adjust your laser settings. And I use steroids tapered over 4 weeks, so pretty much steroids. We have to deal with under and overcorrection, as in every refractive procedure. This photopsia, pretty similar to the other procedures. And there are reports that there is a delayed visual rehabilitation. So I personally did not observe it, but some colleagues do. It might also be due to the laser settings that the cornea takes 1 to 3 days to get crystal clear again. What are the exclusion criteria? Again, pretty similar. So the pachymetry should be more than 480 microns, residual stromal thickness more than at least 250, of course, but my limit is 260. Significant corneal scars, of course. And what are its considerations? We always use the same size and the same shape of the contact glass. So what happens if you have very steep corneas and very flat corneas? You always press, so to speak, the tissue into this certain shape. I will show you a paper later on. Thin lenticules. So if we treat -1 diopter, this lenticule is approximately 30 microns thick. So this is very challenging to remove, especially for novice surgeons. So This is important. If you start with SMILE, don't do the low myops. Start with -3 diopts or even more. But what you may want to do is at the beginning, you can thicken the lenticule. You could put the settings on, so raise minimum lenticle thickness up to 50, for example. So 50 microns is feel pretty comfortable. This is a neutral socket of stroma, so it does not change the refraction, and we showed this in a paper recently. And interestingly, in this group where we thickened the lenticule, safety was even higher than in the normal group, so to speak. Yeah. So it was, at least it was not a disadvantage. You can do that. The next paper I want to show is the impact of extreme corneas. So extreme shaped corneas, like very steep or very flat corneas. So here's this what I mentioned. So if you have a flat, so if you have a normal keratometry, it's nice. But if it's too steep, it's kind of squeezed the tissue, and then the lenticle cut is done, and then it's get relaxed again. So this was my thinking, whether this has an impact or not. Same or vice versa with flat corneas. So, but in these eyes, we're non-inferior, but of course, what we observed, that flat corneas showing more induction of steric aberration afterwards. So dry eye, this is one of the advantages of SMILE over the other procedures. So there are many papers out showing that the dry eye is less or shorter than after LASIK. And this is what we daily observed in our practice as well. The complications, and I on purpose put a paper which is pretty old, so 2014. So this is the very new phase when the SMILE procedure were on the market, and the complications are acceptable. So of course, as I mentioned, corneal intransparency. So at the beginning, probably the laser settings were not clear how to set them, and probably how low you can go. Of course, some lenticle extraction difficulties. And I want to show you some videos. Suction loss approximately 1% according to the studies. So in this case, everything went very well, very fine, and then this happens. So since this was the lenticule cut, I could not go on with the same procedure. So what I did is, since I use a 130 cap, I went more to the anterior part. So I set the cap of 100. So the new cut was more anterior to the old cut. So it was not running into troubles or interfere with the aborted cut. So this works out very, very nice, and you could do it in the same procedure. You don't have to postpone it or so. So I was lucky in this case. Sometimes, since the procedure takes approximately 30 seconds, even if the patient is very compliant, in this case it works very well, some small black spots, but then after a while, if you look on the bottom, you see that there's the conjunctiva coming, some bubbles are coming, and this is exactly the area where the incision is made at the very end of the procedure. So the incision was not made in this case, but the lenticle cut was done, the side cut was done, so I decided to, this was the place from the original, where it's supposed to be, but there wasn't. I tried, but there wasn't. And then I took a 300 micron single-use knife, make a small cut in the area outside of the lenticule, and then it was actually very easy. It was easier than the femtosecond laser cut to open it and go on from there and remove the lenticule. So this is a recommendation from my side, which is very helpful to buy some 300 micron single-use knives, or you can also use a diamond knife as well. And so this was the rest of the procedure. You already know. Black spots, it's a common problem. So make sure everything is clear, moisten the cornea, rinse the cornea. But even if you do all this stuff, you sometimes get some black spots. So in this case, I didn't see any things in the interface. So I started the procedure, and yeah, here it is. And then you see these black spots. So this is amount of black spots which is acceptable. So in my experience, you can go on. So if there are areas where it's like black areas, I wouldn't go on. But if you have black spots, it's fine. It's, of course, certainly a little bit more tougher to separate the tissue. But in the end, it works out very nice. I think you have to go on because lack of time. Just want to mention some enhancement options. Yeah, to sum it up, there are many ways to do an enhancement. You can do a thin flap LASIK, you can do surface ablation, you can do the circle procedure. The circle procedure is basically to convert the cap into a flap. And the shape of this femtosecond cut is like a circle. That's why the name's coming from. So, and it's a very nice, elegant procedure. So this cut is done in 12 seconds, and then you just open up this flap, and you could go on like a normal LASIK procedure. So that's very, very easy. But of course, there are discussions going on. So on the one hand, you promise the patient a flapless procedure, and then you do the enhancement with a flap. On the other hand, if you do surface ablation as enhancement, you promise the patient a painless procedure, and then you do surface ablation with painful post-operative episodes. So we compared it, and we didn't find any differences in terms of clinical outcomes, but of course the visual regeneration was much, much faster after circle than after surface ablation, although the visual quality was slightly better after surface ablation after 3 months. So I skip this and go on with the take-home message with SMILE. It's what is one of the major advantages. It's less dry eye symptoms than after LASIK. The refractive outcomes are comparable to femto LASIK with a very low complication rate, but there is a learning curve. It's certainly a surgical procedure. Theoretically, and higher stability with different or better biomechanical properties. It's not proven still. Complications are manageable, and yeah, well, as I mentioned, there's a learning curve. The visual recovery is probably a little bit slower than after LASIK. Hyperopic correction soon, and we will get a presbyopic profile also very soon. I can drop this information here. And what we still not have in SMILE is an eye tracking system, although the VisuMax 800 is able to do this, but it's, the software is not available so far. And no topography guided profiles so far. But I think this will come up in a few years. So thank you very much.